Acute glomerulonephritis. It mainly involves inflammation of the tiny filter glomerula of the kidney. It usually flow. Acute infection of character is typically present at acute nephrotic syndrome. It may also be seen as the complication of certain systemic disease also. On the basis of etiologic agent, it is divided into main group: acute post-streptococcal glomerulonephritis, acute non-streptococcal glomerulonephritis. Acute post-streptococcal glomerulonephritis, it is very commonly seen in developing countries. It's mostly affected the children, 90% of the cases between 2 to 14 years of age. Usually rest of the 10% of cases are seen in above 40 years of age. In the onset is generally sudden after 1 to 2 weeks of the streptococcal infection, most commonly after the throat infection. Example: streptococcal pharyngitis, and sometime after the skin infection. Example: streptococcal impetigo. Evidence of the etiology may be identified by cultural method of presence of elevated level at antibody against the streptococcal antigen. Acute non-streptococcal glomerulonephritis. Almost one-third of the cause of the infection, acute glomerular nephritis, are caused by the organism other than streptococci. Example: bacteria, streptococci, pneumococci, salmonella virus, hepatitis B virus, mumps, varicella, parasitic infection like malaria. Other than the infection cause, acute glomerulonephritis can be seen in complication disorder like systemic lupus erythematosus (SLE), diabetic neuropathy, uncontrolled hypertension, cord posture syndrome. Pathogenesis. In this, the kidney get enlarged and the weight increase around twice the normal weight. The cortical as well as the cut surface of the kidney show peteal hemorrhage, giving the characteristic appearance of flea-bitten kidney. The affected glomeruli are enlarged and hypercellular along with the filtration of leukocyte. The tubular part of the nephron does not show significant changes. Clinical feature. Typically the patient is young child having sudden onset of sore throat or skin infection 1 to 2 weeks before developing the symptom of the acute glomerulonephritis. The clinical feature mainly include hematuria, proteinuria, periorbital edema over the limb, oliguria, increased serum creatinine, increased blood urea. They may be associated hypertension in the adult, which is usually poor prognostic sign. Diagnosis: blood picture showing azotemia with increased level of serums, creatinine and blood urea. Urine examination show presence of RBC WBC protein. Radiological imaging with the help of ultrasonography or CT scan showing diagnostic changes in the kidney suggest of acute glomerulonephritis. Kidney biopsy help to confirm the diagnosis glomerulonephritis by showing the microscopic changes of inflammation in the glomeruli. Treatment mainly depending on the management of the cause leading to glomerulonephritis and severity of the symptom. Controlling edema and high blood pressure is usually the important part of the treatment. Sodium restricted diet is usually prescribed. Children almost always recover completely in the case of post-streptococcal glomerulonephritis with the non-permanent damage to the kidney. Complication: acute renal failure, nephrotic syndrome, hypercalcemia, chronic glomerulonephritis.